Skip to content. Cookies on www.hse.gov.uk. We use some essential cookies to make this service work. We'd also like to use analytics cookies so we can understand how you use the service and make improvements. Accept analytics cookies, reject analytics cookie. View cookies. Menu. Search X. Search hse.gov.uk. Search hse.gov.uk. Times. Search. Industries. Construction. Health and social care services. Pesticides. Domestic gas. Public services. Agriculture. Entertainment. Waste management and recycling. Motor vehicle repair. Offshore oil and gas. Industries A to Z. Topics. Basics for your business. Ritter. Kosh. Display screen equipment, DSE. Asbestos. Work equipment and machinery. Stress and mental health. PAT testing, portable appliance testing. Work at height. Coma. Topics A to Z. About house. News. Sign up for free updates. Contact us. Information in other languages. Our mission and priorities. Careers. Products and services. Books and products. Training and events. Testing and monitoring. Research and consultancy. Help us to improve the website, give your feedback. Home. Topics. Stress and mental health at work. Stress and mental health at work. Open Stress at Work menu. Stress at Work 1. Causes 2. Signs 3. Risk 4. Employees 5. Mental health. Stress at work. Mental health. Overview, mental health 6. Mental health for employees 7. Mental health for line managers 8. Management standards. Stress at work. Management standards. Overview, management standards 9. Before you start, prepare the organization 10. Step 1, identify the risk factors 11. Step 2, who can be harmed and how 12. Step 3, evaluate the risks 13. Step 4, record your findings 14. Step 5, monitor and review 15. What to do next 16. Do I have to follow the management standards approach? 17. Suicide prevention 18. Case studies 19. Reporting a concern 20. Resources 21. Suicide prevention. Employers have a duty of care to workers and to ensuring their health, safety, and welfare. House promotes action that prevents or tackles any risks to workers' physical and mental health, for example due to work-related stress. These risks can lead to physical and/or mental ill health and, potentially, suicidal ideation, intent and behavior. As an employer, there are things you can do to reduce the risk of work contributing to the causes of suicide. Suicide is a major cause of premature death in Great Britain. However, most suicides are preventable with appropriate interventions. Many suicides are impulsive moments of crisis associated with significant life events. For example, people struggling with isolation, relationship breakdown, financial problems, or work pressures. It can also be linked to pre-existing mental health conditions. 22. Work-related factors may contribute to feelings of humiliation or isolation. An issue or combination of issues such as job insecurity, discrimination, work stressors, and bullying 23 may play their part in people becoming suicidal. Manage the risk. You should prevent or reduce stress caused by work factors. But also be aware of the impact of non-work factors and, where possible, try to help people through these. You could, for example, be flexible with working hours. Allow workers time for counseling or medical appointments. Allow them time to get other advice, for example from solicitors. Direct workers to appropriate help, for example from their GP or an employee assistance program, EAP. Identify other sources of potential help. Promote good mental health in your workplace. Talk about mental health and stress within teams. This will help reduce or remove any stigma attached to mental health issues and provide a more supportive, understanding environment. Keep in touch with workers who are home working 24. Tackle potential mental health triggers such as bullying, harassment and discrimination. Consider the impact of change, redundancies, and job security. Consider things happening at work that are likely to be additionally stressful for workers, for example, change, no matter how small. Reorganization, especially if this may lead to job losses. Disciplinary action. If you manage someone with pre-existing issues, for example a mental health condition, ask them how you can support them. Ask how you can help if they start to exhibit symptoms, for example give them time, put them in a separate room or call a named person. Restrict or control access to items which can be used by someone with suicidal thoughts, for example drugs or anesthetics, pesticides, and weapons. Support workers who may be suicidal. If you think someone may be suicidal, encourage them to seek help from their GP, EAP, the Samaritans, or to talk to a trusted friend or family member. Signs that someone is struggling include ups and downs in their mood, not wanting to mix socially anymore, changes to their routine, like sleeping or eating, seeming flat or low on energy, neglecting themselves, showering less, or caring less about their personal appearance, making reckless or rash decisions, increased alcohol or drug abuse, being more angry or irritable than usual, talking about suicide or wanting to die in a vague or joking way, giving away their possessions, saying goodbye to people as if they won't see them again. This list was adapted from the Com25 website. Support workers after an incident. If someone takes their own life, you should consider the impact on their colleagues, particularly if the suicide happens at work. Support your staff, give them the opportunity to seek help through your EAP, occupational health provider or counseling and to talk about what has happened. Check that other workers are not feeling the same or under pressure. Make staff aware of the support available if they are having similar thoughts. Use the event as an opportunity to review your risk assessment for work-related stress and mental health. Managers, directors, owners, CEOs etc. are also employees. Look after them, and yourself, too. Suicides in the workplace are not Ritter reportable. Suicides in the workplace are not Ritter reportable 26 as the regulations only require you to report a death from a workplace accident. Help for managers. Guidance for managers on mental health at work 27. Samaritans 28. Mind 29. Campaign Against Living Miserably, 30. NHS Help on Suicide 31. Back to top. Related content. Mental Health at Work 32. Stress Management Standards 33. Stress Resources 34. Case Studies 35. Mind 36. Samaritans 37. NHS Help for Suicide 38. Com 39. Link URLs in this page. Stress at Work www.house.government.uk/stress/index.htm. Cost www.house.government.uk/stress/causes.htm. Signed www.house.government.uk/stress/signs.htm. Risked www.house.government.uk/stress/risk-assessment.htm. Employees www.house.government.uk/stress/help-employee.htm. Overview, Mental Health www.house.government.uk/stress/mentalhealth.htm. Mental Health for Employees www.house.government.uk/stress/mentalhealth-employees.htm. Mental health for line managers www.house.government.uk/stress/mental-health-line-managers.htm. Overview, Management Standards www.house.government.uk/stress/standards/index.htm. Before you start, prepare the organization www.house.government.uk/stress/standards/before.htm. Step 1. Identify the risk factors www.house.government.uk/stress/standards/step1/index.htm. Step 2. Who can be harmed and how www.house.government.uk/stress/standards/step2/index.htm. Step 3. Evaluate the risk www.house.government.uk/stress/standards/step3/index.htm. Step 4. Record your findings www.house.government.uk/stress/standards/step4/index.htm. Step 5. Monitor and review www.house.government.uk/stress/standards/step5/index.htm. What to do next www.house.government.uk/stress/standards/what next.htm. Do I have to follow the management standards approach? https://www.house.government.uk/stress/standards/doi.htm. Suicide prevention www.house.government.uk/stress/suicide.htm. Case study www.house.government.uk/stress/case studies/index.htm. Reporting a concern www.house.government.uk/stress/reporting-concern.htm. Resource www.house.government.uk/stress/resources.htm. Pre-existing mental health conditions www.house.government.uk/stress/mentalhealth.htm. Bullying www.house.government.uk/stress/resources.htm. number other. Homeworking www.house.government.uk/homeworking/index.htm. calm/https://www.thecomzone.net/ Ritter Reportablate www.house.government.uk/ritter/index.htm. Guidance for managers on mental health at work www.house.government.uk/stress/mental-health-line-managers.htm. Samaritans www.samaritans.org/ Mind www.mind.org.uk/ CALM. Campaign Against Living Miserably, https://www.thecomzone.net/ NHS Help on Suicide /www.nhs.uk/mental-health/feelings symptoms behaviors/help for suicidal thoughts/ Mental Health at Work www.house.government.uk/stress/mental-health.htm. Stress Management Standards www.house.government.uk/stress/standards/index.htm. Stress Resource www.house.government.uk/stress/resources.htm. Case study www.house.government.uk/stress/case studies/index.htm. Mind www.mind.org.uk/ Samaritans www.samaritans.org/ NHS Help for Suicide www.nhs.uk/mental-health/feelings symptoms behaviors/help for suicidal thoughts/ CALM https://www.thecomzone.net/ Is this page useful? Yes, no. Report a problem with this page. Footer links. Industries. Construction. Health and social care services. Pesticides. Domestic gas. Public services. Agriculture. Entertainment. Waste management and recycling. Motor vehicle repair. Offshore oil and gas. Industries A to Z. Topics. Basics for your business. Ritter. Kosh. Display screen equipment, DSE. Asbestos. Work equipment and machinery. Stress and mental health. PAT testing, portable appliance testing. Work at height. Coma. Topics A to Z. About house. News. Sign up for free updates. Contact us. Information in other languages. Our mission and priorities. Careers. Products and services. Books and products. Training and events. Testing and monitoring. Research and consultancy. Search. Copyright. Cookies. Privacy. Accessibility. Disclosure of information. Vulnerability disclosure. All content is available under the Open Government License v3.0, except where otherwise stated. Updated, June 4, 2024.